Good evening and welcome to episode number 15 of Increase Your Impact, where tonight I am joined by my friend Char Richard from Cochrane, just outside of Calgary. And Char is joining me tonight to talk about compassion fatigue, which is a subject that I honestly don't know a whole lot about, but Char sure does. And I think it's an important one for people to know more about because healthcare professionals are very important to all of us. And compassion fatigue is definitely a challenge that healthcare workers face. So learning how to help them with that challenge is a great way to have an impact in the world. So I look forward to learning more, and thanks for joining us on the show tonight, Char.
Yes, thanks for having me. I can't believe you're on episode 15. It seems like we were just having tea when you were starting this.
I know, it's pretty crazy. It's been, I guess 3 months, a little over 3 months. So still going strong and still enjoying it. So
well, congratulations.
Thank you. I appreciate it. So as Char is a clinical social worker with a specialization in helping healthcare providers and helping professionals prevent burnout while increasing compassion satisfaction. She is the creator of Caring Safely, an online program that teaches caregivers how to get all the benefits of providing compassionate care without the risks of burnout. Char has been providing workshops, individual coaching, and keynote presentations to community, provincial, and federal organizations since 2009. And in 2015, she published a book titled 20 Quick Strategies to Help Your Patients and Clients Manage Stress, which includes a chapter on clinician wellness. You can find Char's writing and online classes for healthcare providers and helping professionals at www.charlenerichardrsw.com. And I will definitely include a link to Char's page in the show notes. In fact, I'm going to paste it into the chat here right now. So yeah, that's a bit about Char. Anything you wanted to add?
No, that pretty much sums it up. Thank you.
You're welcome. So yeah, as I mentioned, tonight we're going to talk about compassion fatigue. We'll go through some interview questions on that. And for anyone watching live, feel free to chime in with any questions you have, and we'll do our best to answer them. So to start us off, I mentioned a little bit about compassion fatigue, but why don't you tell us a little bit more about what compassion fatigue is and what your work is that relates to that field?
For sure. So I think maybe before talking about compassion fatigue, what I'd like to do is talk a little bit about compassion in general. So one of my favorite, most succinct definitions of compassion is compassion being defined as the emotional response when perceiving suffering and involves an authentic desire to help. So compassion usually involves two different components. We have empathy. So we empathize with another person. We understand or we feel what they're feeling. We want to understand what they're feeling so that we can use that empathy to try and help them. But we don't just empathize with them. We also have a motivation or a desire to help them alleviate whatever the pain or suffering is. So those two components are what make up compassion. And so when we look at compassion fatigue in terms of helping professionals or healthcare providers, we look at these professions as being people who are compassionate on a daily basis with the people we work with, right? Mm-hmm. So our job is to go in and help people. And one of our main tools is being compassionate and providing empathy. So over time, and because our schools and training don't often talk about compassion and compassion fatigue in general, if we don't know how to practice safe empathy, and if we don't know how to be mindful of our compassion, there's the ability for it to have some negative health impacts on us. And they tend to start slow and increase over time. It's not like a one incident happens and then you have compassion fatigue, right? Mm-hmm. So if you were looking at a single incident that caused trauma, so say you have no fear of driving is fine, you get into a car accident one day, the next day you might have post-traumatic stress disorder because of that car accident, right? Yeah. And the signs and symptoms, boom, they're there. You're scared to get in the car. You're scared of driving. Your heart rate's up, sweating, all of that stuff. compassion fatigue is not like that. Compassion fatigue is something that's going to grow over time. So we get into these fields and we are compassionate in the beginning, and we have all this energy and this care to give. And over time that can start to deplete, right? And basically what starts to show up are at the lower levels, it's just kind of like symptoms of chronic stress. So maybe we're a bit fatigued, we're irritable, maybe we're withdrawing, we're pulling away a little bit. And it can go all the way to the other end of burnout. And burnout can lead to serious mental and physical health concerns, right? It's not uncommon for healthcare professionals to develop anxiety and panic disorder themselves, to develop depression. I just actually sent a link out on Facebook about a blog post that was written about physician suicide, right? And so because we're the healthcare providers and the helpers, there's almost a stigma to saying, hey, I need some help. Right?
Yeah. Where can they turn to for help, which is where someone like yourself would come in.
Yeah, absolutely. Yep.
And obviously anyone in the healthcare, any healthcare practitioners are very important to our society as a whole. So they completely deserve to get the care and attention that they need when these sorts of things start to happen. So I think that's great that there's people like yourself who are doing what you can to help.
Thank you.
So can you tell us a little bit more about how you first became interested in this field?
Yeah, it was pure luck or perhaps divine intervention. So I had mentioned a little bit earlier about how in school they don't often talk about this, right? I took my 2 degrees. My background is in clinical social work. I have a Bachelor of Social Work and a Master of Social Work. And my entire focus had been on clinical interventions with adults and in the field of addictions and mental health and trauma.
Okay.
So not once in my 5 years of getting my 2 degrees did one of the teachers talk about compassion fatigue or a couple other concepts like vicarious trauma or burnout. So I didn't know what these things were. And I got into the field and my first job was at a women's shelter in northern Manitoba. So I was doing crisis work with women and children who were leaving or fleeing abusive relationships, and doing some longer term counseling with women who had left the relationships but still weren't necessarily out in the community on their own. They were in our extended program. So without knowing it, I just kind of got dropped into the field of trauma. And along with that, often some anxiety, some depression, some addictions as well. And when you first start learning how to be a helper, and in the beginning, that feeling when you first help someone and they come to you and they say, that really helped, or this is what's changing in my life because of that help. It's just wild, the feeling that you get, right?
Yeah.
I mean, our brains are designed to give us good feelings when we're compassionate to people and we help them. Yeah. Because from an evolutionary perspective, we needed to be compassionate with our tribe, right? We needed to keep our tribe strong so that we could survive.
Exactly. Ensure the survival of the species, right?
Exactly. Yeah. So of course, all the good things in our brain go off when we're being compassionate and we get that recognition and that connection with people. So I almost kind of relate to new caregivers. So people who are new to the field, I feel like we go out there and we're doing these Care Bear stares, right? Like we are just caring all over the place. We're connecting with these people and it feels good. And over time, if we don't know how to protect ourselves while we're doing that, this is when the compassion fatigue starts to creep in, right? So fast forward 3 years later, I'm in addictions and mental health and trauma work for 3 years, and I'm in my last year of doing my graduate degree. And I'm thinking to myself, it was sometime around, I would say January or February, and I was finishing my degree in June. And I was at the point where my compassion fatigue was at such a high level. I had such high anxiety every single day. I was having panic disorder, not sleeping, all the getting to the point where it was looking like burnout was going to be coming. And burnout was something that I knew about, but compassion fatigue wasn't. And my thought was, I'm not going to be able to stay in this field. Like, I think I'm done. I've done my 5 years. I think I'm done. I've got tens of thousands of dollars of debt now. This is the only thing I'm trained to do, right? I used to love this job. And now I'm going to graduate in June and I'm going to have to go back to waitressing, right? Because I just can't do this. And so then in May of that year, there was a workshop that I got to go to, and it was called Walking the Walk, Compassion Fatigue, Vicarious Trauma, and Burnout. And within, I would say 15 to 30 minutes of the workshop that I went to, I knew my life was changing, right?
Wow.
whole phenomenon of what compassion fatigue is, I was thinking, like, you are speaking my life. You know exactly what's happening right now.
Yeah.
So, well, it wasn't, poof, I know what this is, things are better. I knew that there was a framework for it, right? So if this is a concept, obviously there's a framework to heal from it. So from then on, I finished my degree. And then from the rest of that year, I started taking training in compassion fatigue and went through a couple different training programs, did a lot of research of it on myself. And decided this was going to be one of the areas that I actually specialized in. Was part of it was because I wanted to help other people. I felt, how come they're not talking about this in school? We need to get this information out there.
Yep.
And the other part of it was, well, if I start blogging about this, writing about it, and speaking about it, I'm going to have to hold myself accountable as well, right? So it was a good way to kind of keep myself in check there. So that was how I got interested.
And ultimately benefit yourself too, if you're more aware of what's happening with you. You can give yourself probably better self-care as well, right?
Absolutely. And I mean, the strategies that I teach people now, they're accumulation of about the last 7 years of me doing this research, right? Like it built on and on and on, all these different ways that we can learn to be in this field and still be healthy.
And would you say that over those 7 years, the general awareness of compassion fatigue in your field is growing? Or is it still something that is, like you talked about doctors not asking for help? Is it still something that's kind of taboo? I don't know if that's the right word.
Yeah, taboo and stigma. I think that there's definitely still a stigma around it. It might vary in different fields. So some of the really cool things that are happening in Alberta is the recognition of the impact of being a helping professional for EMTs, right? So there had been such a rash of suicides that were happening in first responders that it started getting provincial awareness.
Yeah.
So certain fields are really zeroing in on the impact of their work. Other fields, maybe not so much. The research is definitely coming a long way. We're seeing things like one of the dissertations that I read at the end of last year, I think it was yoga for compassion fatigue. And I mean, I think yoga is one of my main self-care tools myself in terms of managing my compassion fatigue and the work that I do. Yeah. So we're seeing a lot of research in it. We're seeing what is also cool is that we're seeing more research about the benefits of compassion in and of itself, right? So we're not just looking at the negative impacts of compassion fatigue. We're starting to say there are also good things that come from compassion, right? So how do we cultivate that? How do we tap into that? So definitely, I think still some stigma in some fields, but a lot more research coming. And I get emails from people saying, how can I get this conversation going at work? How can we get this conversation going with management? So it's coming.
Sounds like progress to me.
Absolutely.
So you mentioned a few things like anxiety and burnout, and how compassion fatigue is something that generally builds up over time. What are some of the risks, I guess, of compassion fatigue if it is not taken seriously and treated properly?
So that's a great question. Compassion fatigue is easiest to treat if we know about it early on, right? When we're in kind of that beginning phase of it. So if I had have known what compassion fatigue was in my first year and started noticing some of those signs and symptoms weren't just stress, it would have been much easier to recover than waiting until 3 years in, right? I think the biggest risks are I think it kind of breaks down into 3 different fields or 3 different categories, is physical or mental illness themselves. So when we're looking at it getting to the point where the physical or mental illness is impacting the clinician's ability or the helper's ability to actually function in their day-to-day life, to go in and work, right? So the symptoms aren't just showing up a couple days a week, they're chronic now. And they're likely to need some type of psychological or medical intervention in terms of recovering from that, right? So there's a reason why the healthcare field has the highest level of absences and leaves, right? I mean, there is a connection there. Yeah. So our own personal physical and mental illness, I think the impact on patients is something that maybe we don't really have enough research about in terms of if we could see a clinician or a healthcare provider with high levels of compassion fatigue, what does that impact on the patient, right? I see it all the time. So I work in health, I didn't mention, but I work in mental health and primary care right now. So I see patients who are going to see their doctors and have some type of stress or a mental health issue, and they want some support. So they'll come and see me, and I'm right in the doctor's office. Yeah. So I get a lot of accounts from patients in terms of what their experiences have been with other healthcare professionals, right? Sometimes it's phenomenal. They have great connections, great support. And sometimes the responses they get from other healthcare professionals, I know, wow, that clinician has some compassion fatigue or burnout, right? They just weren't there to listen to them or support them. So I think the impact on patients, and then I think the third thing is that it often gets to the point where the healthcare provider or the helping professional thinks, I'm going to have to leave this field, right? Like I just can't do this anymore. And we're losing good people with good skills, and they're leaving the field because they don't know how to keep themselves healthy within it. Yeah.
So there's a couple questions from that I wanted to ask. I guess first off, what are some of the best ways to self-treat if someone's worried about, compassion fatigue occurring with them?
So I know that you put up a link to my website. On my website, there's a tab on the top right-hand corner that says free. And when people sign up for the free resources, there is a free training video on there. It's actually a 3-part training video series about compassionate care and all of these things that we've been discussing. Yeah, perfect. There is an assessment in there. So there's a really cool assessment called, cool in the nerdy way, that this is the stuff that I like to study.
Yeah. Everyone has their thing.
There's an assessment called the Professional Quality of Life Scale. And this scale, it's this just a self-administered scale. They can download it, answer the questions. It gives people a rating where they score in terms of compassion satisfaction, which is the good stuff we get out of our work.
Yep.
Vicarious trauma, so that we can know what our secondary stress is, right? So how we're being impacted by working with people who have trauma, and our compassion fatigue. So that in and of itself is a great scale just for people to scan through and see, okay, so these are the different symptoms that are categorized with each of these different experiences. Where do I score? Is it low? I'm okay. Is it high? Should I look into it a little bit more? And if people are identifying with compassion fatigue or burnout, then I think knowledge, right? So getting knowledge, getting information, and figuring out what is going to be the best way for them to heal. So I created the video training series that's in there specifically for people who are just, the main question is, do I have compassion fatigue? And if I do, what do I do about it, right?
And could that apply to, I'm guessing, to people who aren't necessarily working in the healthcare field, but maybe are someone like, I don't know, a teacher or someone with sick family members who's, obviously they're having to display lots of compassion, and, they may also develop compassion fatigue. I'm guessing that probably does happen.
Absolutely. So I've kind of niched my work into healthcare providers and professionals in general. But yeah, teaching is a huge, I have patients who are teachers, and we talk about compassion fatigue and the impact of their work. A couple other areas that I don't talk about too much are people who are involved in pet care. So veterinarians, rescue work, that's kind of a whole other subdivision of compassion fatigue. Same experiences, same symptoms. There's actually a woman who does a lot of work. She has an online course for people who are in animal care and rescue with compassion fatigue. So there are ways to get connected for that. We talked a little bit about first responders. I think that their issues are a little bit more dynamic than, or have certain dynamics that I don't necessarily touch on quite as much. They've got that immediate crisis response and just the dynamics of their work in general. In law, so people in law enforcement, crown attorneys, district attorneys if they're in the US, defense lawyers. So anyone who works with people who are in pain or suffering on a regular basis has that ability. And definitely we're seeing a huge wave of caregiver burnout for personal caregivers, right?
Yeah. So you mentioned with yourself, if you'd known some of the early warning signs to look out for, maybe you would have gotten some help for yourself earlier on. What are some of those early warning signs that someone may be in the early stages of compassion fatigue?
Yeah, so the early warning signs that we want to look out for are fairly similar to chronic stress, right? So starting to have some of that, maybe you're a little bit more irritable, maybe you're a little bit beginning to withdraw or isolate, right? So some of the early warning signs, coming home and instead of connecting with people and going out and doing things or spending time with your family, maybe you're pulling away a little bit, right?
Mm-hmm.
Maybe kind of numbing out on food or alcohol or drugs or TV, Netflix binges, that type of thing.
Yep.
Pulling away from some of the things that you used to get pleasure from, right? So one of the first things that we tend to notice is that self-care gets dropped, right?
Mm-hmm.
So a clinician or a helping provider who used to come home and then go for a walk or go to yoga or go to a hobbies class of some sort is giving that up. So we notice the self-care starts to drop, get a little bit more fatigue, some physical fatigue, maybe catching colds more often, starting to notice that it's harder to recover.
Yeah.
And then I think where it starts to differentiate when it's compassion fatigue is that we do start to lose that ability to care. So once upon a time we start, and it's just, like I said, it's that Care Bear stare. We're connecting with people. We're there. We're present. We're focusing on them and we're being compassionate. But then maybe we're working with someone and we're thinking, oh, I've got all this stuff to do after work. I got to make sure I pick this up. I have to do that. So maybe we're not fully connecting with people anymore, right? And then we kind of go, oh, I need to come back and focus on you. Maybe we start to get a little bit annoyed that, oh, I have this patient today, or oh, I have that patient today, right? And then we start to feel guilty that we have these experiences. But because it's not happening all the time, it's only happening every once in a while, there are no really red flags going on, right? So had I noticed those signs earlier on, then I would have been able to start looking at this concept, right? And what do I need to do in my life in order to stay in this field and still stay healthy?
And then if someone is noticing some of these, early warning signs in themselves, or maybe someone that, one of their loved ones is noticing them, what are kind of the best steps to go to seek help?
I look at it at a few different ways. So one of the main things that compassion fatigue specialists or people who offer supports around compassion fatigue, we talk a lot about self-care, right? We talk a lot about the very, very basics in terms of how do we focus on our eating so that it's regular and healthy? How do we make sure we're getting enough sleep? And how do we make sure we're getting enough exercise, right? Sometimes I feel bad talking about self-care as the strategy because I feel like I'm shaming that individual in terms of, well, you're going home and you're not doing self-care, right? But that's, when you don't have that energy, how do you do it? So self-care is definitely one way. I think for me, the biggest eye-opener, there's a book called, and I'm just going to show it to you. I don't have the cover on it anymore. So Help for the Helper is written by Babette Rothschild. I adore this book. Probably a couple years into my work around compassion fatigue is when I read this book. And a lot of what she talks about, I just noticed how Canadian I sounded when I said a boat there.
A boat, yeah.
Yeah. A lot of what she talks about is how do we practice something called safe empathy, right? How can I empathize with someone in a mindful way so that I'm being present and not being completely absorbed by their experiences? Because if you think about the people that we see on a regular basis, we see them when they're in pain most of the time, right? Yep. So they could be coming in extremely angry or extremely anxious or extremely sad. And when we empathize with them, we can absorb those emotions, right? So we want to learn strategies for being with them, but still protecting ourselves, right? So some of those are, for me, mindfulness interventions. So mindfulness-based stress reduction was a program that I took. So mindfulness meditation is a really good way to increase that awareness and help you learn how to be more mindful when you're interacting with people. I think yoga is a great way to help kind of flow some of the experiences through your body, right? Because sometimes we're just sitting there with people who have such intense emotions or in so much pain, and we catch it and we feel it, and where does it go, right?
Yeah.
I wrote a blog post, it must have been about the end of January, I think it was, about how there have been a couple times where I've actually kind of had some tears come out on the yoga mat at the end of the day, right?
Wow.
And both those were in the past year when I had patients who come in who had some significant grief, right? So just such significant loss or significant experience that it's just, we work with these humans who should not have to experience this level of pain and suffering, and we feel it. But we can't process it in the moment because we say goodbye to them and then we walk in and see the next patient, right?
Yeah.
So healthy that, for me, yoga is a way to, okay, so some of that grief is going to come up again. I'm going to let it come up. I'm going to let it be there. I'm going to let it come out, and then I'm going to stay healthy. Right.
Mm-hmm.
So yeah, so there are different ways. There are books people can read, mindfulness, yoga, self-care.
Yeah. And as always, they can also ask for help, right?
Yeah.
Which is, if you're ever feeling lost with anything, asking for help is always an important step, and especially anything mental health related.
For sure. I mean, family doctors are often the first place, right? They go to family doctors and they say, this is what I'm experiencing. And a family doctor will try and get people connected to the proper resources.
Yeah. And if you're in, I know in Alberta, there's great, 24-hour phone lines and everything like that for anyone who's really kind of feeling like they're at their wits' end. So I guess once someone does start treating the issues they're having, what are some of the benefits you see in people who, treat their compassion fatigue?
I think the joy for the job comes back, right?
Mm-hmm.
So I had talked a little bit about when my compassion fatigue was at its height, I didn't even like my job anymore, right? It was, you kind of get to this point where it's like everybody just wants something for me and I don't have anything left to give, right? Like there's just nothing left. And when you get to that point where you're balanced and you're working from a place of abundance and you're full of energy and you're able to connect with people, you start to get the benefits. And this is where I really like the research around the benefits of compassion.
Yeah.
In the sense that, if all my patients show up in a day, I have the ability to connect with 8 different people and provide compassionate care to 8 different people. Not many people have that opportunity.
That's a pretty big impact.
And so, right, so we get to the point where I start to feel grateful, right? For, as I'm walking to pick up my next patients, I think about the gratitude of, okay, I'm going to get to spend this time with this person and connect with them. Yeah. So I get to cultivate compassion instead of have compassion being draining me. So yeah, I think a big part of it is we get energy from it. We get nourishment from it. Compassion also tends to give us a sense of purpose and a sense of meaning. And there are so many mental and emotional and health benefits that come with having that sense of purpose and meaning, right? Yeah. Kind of what you do, right? I mean, you help people make an impact in the world.
Yeah. No, we all want to help people out, really. At the end of the day, that's what pretty much any person wants to do. So
absolutely.
Being able to do that again and being able to do it in a way that you enjoy as your career, like that's a pretty good benefit, I would say.
It's pretty cool when you think about it, right?
Yeah,
but it's that ability to also have a life outside of work, right? Mm-hmm. So compassion fatigue, you're probably mustering up everything you have to get through your workday and kind of collapsing at the end of the day or withdrawing. Whereas now you actually get energy from your work and you can still go out and have a life, right? Yeah. So it's about being happy and healthy at work and outside of work.
Really helping to find that balance.
Yeah, absolutely.
So I think you showed us one there. Are there other books, resources that you would recommend for people who might want to learn more about the subject?
Yeah, there is another book. There's a book called Trauma Stewardship that I would recommend for anyone who works. One of the areas we didn't talk about in terms of compassion fatigue was the impact on the environment, right? Mm-hmm. So for people who work or whose passion is for kind of helping the environment, seeing all the trauma that takes place in our world and on our earth, that's a really great book for that. So I think that Trauma Stewardship is a good one for people who are in environmental work, but also compassion fatigue in general is a great book. Like I say, Help for the Helper. And then, so I have my program as well. On this Friday, so April 1st, I'll be putting up my spring classes. So right now there are no classes on my website, but on April 1st, I'll be listing my spring classes. And what I do in terms of my program at this point is I have kind of an introduction to caring safely, which is a 90-minute program where I talk a bit more in depth about different strategies and information. So I have that on April 20th is actually when that class will be.
And these are online classes, right?
These ones I'll be doing online. They'll be live online. Yeah. So those will be 90-minute classes. And then I have a longer program. It's an 8-week, more comprehensive program that I'll be launching in the fall. So that one is going to really, for people who really want to get into it, learn it, and actually make the lifestyle changes that are required and practice the strategies that are required to really get to that point of being balanced. So that one will be coming out in the fall.
Cool. And I mean, you also have your book that you wrote last year on, 20 strategies to help patients and clients manage stress. Maybe not entirely about compassion fatigue, but I'm sure there's some correlation there. Are there, a couple of your favorite quick strategies from that book that you'd like to share?
Yeah, so my book, I have a copy of it here. We can see it. So yeah, 20 quick strategies to help patients and clients manage stress actually does have a direct correlation to compassion fatigue management, because one of the protective factors in doing this type of work is having skills and strategies and tools to be able to help the people we work with, right?
Mm-hmm.
So this book is designed for people who are either early on in their journey as a helping professional and maybe don't have that toolbox of things that they can pull out as needed. Or for people who maybe stress isn't their primary, or maybe mental health and stress isn't their primary background. So the reason I wrote this book was actually because other helping professionals like pharmacists, health management nurses, dietitians would come up and say to me, I have a patient with stress. I don't think they need a referral for mental health, but can you give me a quick strategy to help people with stress, right?
Mm-hmm.
So after getting enough of those requests, it became a book.
Yep.
So yeah, so it does have connection in terms of compassion fatigue that way. Most of my work is very much mind-body related, right? So a lot of the things that I teach people and the strategies in this book have to do with recognizing the signs and symptoms in your body when you're stressed, right?
Mm.
So everybody experiences stress. Sometimes it's helpful and can save our lives.
Yep.
Sometimes when it happens too much or it becomes chronic, it can have a negative impact on us.
Yep.
So one of the first things I'll ask people who are stressed is, so think about the last time that you were stressed and tell me where you felt it in your body. And some people will right away, they'll start telling me, my jaw was tense, I was hot, I was kind of agitated and fidgeting. And other people will say, well, what do you mean? And I'll say, well, every emotion we have has a physiological sensation as well, right? So where are you feeling this in your body? And sometimes it will take me, 5 to 10 minutes to help them figure out when they're stressed, what are they feeling in their bodies as well. So the first thing that I do teach people is to recognize, start paying attention to those experiences of stress and figure out where it is in your body, because that is going to be your earliest warning sign that you're stressed, right?
Yeah.
And the earlier we are aware of our stress, the easier to interrupt it and kind of calm our body down. And after that, what I tend to teach people is, okay, you know what your warning signs are, now that you're paying attention to them. The first thing I tend to teach people is a deep breathing strategy. And because this is probably the quickest way to calm down your nervous system, right? So your stress response has triggered your sympathetic nervous system, and we want to bring on the relaxation response. So instead of me getting into it here, there is actually under, on the free tab there, when people sign up, not only is there a training video for the compassion fatigue, but I also have guided relaxation and guided meditations for people who want to learn how to use guided relaxation practices for things like stress as well.
Cool. Yeah, and I mean, I can definitely attest to the benefits of deep breathing and meditation to help just with general stress or anger management. Even, I've become a lot more mindful of my own emotions the last few years, and that taking a minute to just take some deep breaths helps tremendously for me. So,
well, and just remember that you and I met at the meditation gathering, right?
Yeah, at World Donation Summit. That's right, we did.
Yeah.
Which was actually the first time I'd been to like a group meditation, so that's cool.
Yeah, and it was a good one too.
Yeah, it was great. Look forward to hopefully doing it again this summer.
Yeah.
So anything else about that topic that you wanted to mention before I get into a few of the questions on impact in a broader sense?
I don't think so. I mean, I think, again, just to kind of reiterate that it's recognized that it's pretty much, like, it's a natural phenomenon, right? We expect it to happen in healthcare providers and helping professionals if we don't know what to do with compassion. And so it's not, am I going to get it? It's kind of, what do I need to watch out for? Because there's a pretty good chance that I could start to develop it to some level, right?
Yep.
So I think anyone working in the field, just even making themselves familiar with the concept and the signs and symptoms is really important.
Cool. Well, you certainly provide lots of great information and resources and options for people to check out. And it'll be interesting. My sister's getting married this weekend, and a couple of my family members are healthcare professionals, and I'm going to know something to talk to them about and see.
Excellent. Yes.
See if what their thoughts on.
Do you know what compassion fatigue is?
Yeah, I will.
Yeah.
So that'll be good. So yeah, a few more questions in a broader sense on the topic of impact. I always like to ask, what does impact mean to you?
Mm-hmm. So impact to me, I think it's an honor, right? The ability to have an impact on somebody else is something that I, at this point, am continuously grateful for. So in my field and what I do, people show up in a very vulnerable state. They're not showing up because things are going well. They're showing up because they're in some type of pain and suffering. And I mean, in my role, we go deep fast, right? So, hi, how are you? And 10 minutes later, I probably know a lot of things that nobody else in the world knows about you, right?
Yeah, yeah.
So people show up and they're very vulnerable and they trust me and they share their thoughts and their feelings and their experiences with me. So impact to me is just, it's kind of the ultimate honor in terms of being able to have that impact. It's something that I absolutely feel grateful for and am honored to have.
And so that is the impact that you'd like to have on the world then?
Yeah, and so that's me as a clinician. Me as a compassion fatigue specialist, I think that what I'm trying to do is not only help the other healthcare professionals, but I'm look at the ripple effect, right? So if I can help healthcare professionals, every person they are then helping is being impacted because they're at a healthier place, right?
Yep. Yeah.
So yes, as a clinician, I think I get the individual connection and honor, and then I'm looking for that ripple effect in terms of helping healthcare providers and helping professionals.
Yeah, and that, like you said, that ripple effect can be huge. And it's, becomes ripples, creating more ripples, because if the healthcare professionals can help their patients better, then those patients are probably better in their lives, which ripples further. So yeah, that's a great way to have a huge impact, and great for you for doing that. And then what would you say, if anything, is holding you back right now from having a bigger impact?
I think so. Once upon a time, prior to learning about compassion fatigue and kind of having balance, I was an all or nothing person, right? So work hard, play hard, work the equivalent of 2 jobs, have no balance, right? Since I would say probably in the last 5-6 years for sure, I've really scaled back on what I do. I've really focused on prioritizing time, energy, and money, right? So before I say yes to something, saying no again is another strategy for compassion fatigue, right? The ability to say no and set boundaries, which honestly probably one of the areas that I spend the most time on with people, because people have such a hard time saying no, right?
Yeah.
Saying no to someone is so difficult.
I can attest to that.
So for me, I got really good at saying no. It took a couple years and it felt really awkward at first and scary, but saying no and prioritizing time, money, and energy on things that are going to nourish me and help me live my dharma, so to speak, right? Which I believe is kind of working in this area. So I hold myself back in the sense that in the past, I might have worked 12 or 16-hour days to get this information out, whereas now I say, no, I'm going to take the time and go for that walk, or I'm going to connect with a friend or talk on the phone, or I'm going to go to yoga class, right?
Yeah.
So I think that holds me back. And then sometimes, so my belief is if I can share this information with the help of technology and online like this, right? I can reach so many more people than face-to-face one-on-one.
That's true.
So yeah, and so that's why I love when you asked me to do this. I said, okay, I've been wanting to get on video. I've wanted to do more interviews. I want to interview people. But me and technology, sometimes we're a little feisty together, right? So I think, I had told you about the webinar that I tried running back in the fall where it was just a disaster. So sometimes technology is what holds me back. So I'm getting better. I'm learning. I'm reaching out to people. Doing things like this is helpful. For me, it'll be more about how do I can scale this so much more, this information and this help people so much more if I can get it online and start doing more online work.
And using technology effectively.
Yes.
Because one thing to use exactly, it's one thing to use technology, but using it in an effective manner makes all the difference, because there's just way too many platforms out there for anyone to hope to and even need to use, right? So I think that's a pretty common one. So that's all good. Any questions from our live audience? If you have any, feel free to type them into the chat, and we'll see if we can answer them. If not, that's all right. You mentioned, some of your upcoming courses. Is there anything else that you're up to that you wanted to share?
Yeah, sure. So my schedule, I don't have the exact schedule in front of me. I've got kind of the gist of it up there on my wall calendar. I have 5 classes coming out between April and May, and they will all be 90-minute classes online where I'm going through content and I'm available to chat and answer questions, and people can download and keep their recording after.
Yeah.
So one of the classes is on caring safely. So that'll be the first one on April 20th. I'll have another class on anxiety. Another one on depression.
Yeah.
I see a question here.
Yeah, we'll answer the question after you finish. I won't interrupt you mid talking.
The caring safely one for compassion fatigue, one on anxiety, one on stress, one on depression, and then one on mindfulness meditation. So as you know, I adore mindfulness meditation. I'm a mindfulness meditation teacher. It's such a life-changing impact on me. That this one is sort of just an intro. Like I say, it's a 90-minute, learn what it is, get a couple practices in. And then what I'm looking to, I haven't picked the dates yet, but I'm looking in June to do a 4-week mindfulness meditation. So actually, kind of have some downloaded audios that they can practice in between our weekly sessions. So
cool. Yeah. Awesome. So we did get a question from Elizabeth, and Elizabeth asks, is there any difference between compassion fatigue for mental health providers and medical providers?
So this is a good question. I think that the compassion fatigue, the one thing that might be a little bit different that we didn't really get into too much detail about is the concept of vicarious trauma. So vicarious trauma means that somebody can experience trauma without experiencing the traumatic experience themselves. So mental health providers often work with people who have experienced trauma. And the more that we are exposed to trauma, the more likely that we'll develop vicarious trauma. And vicarious trauma can show up as the same symptoms of post-traumatic stress disorder. So I'll give myself as an example instead of patient or client. When I first started working in the women's shelter, I was working with women and children who had fled abusive relationships. And so each day I was hearing different stories from women about the abuse that they had been experiencing. And not only was I hearing the stories, but I was also, I could see them with their bruises. I could see the impact. I could see how the children were acting. Yeah. So while I didn't experience the domestic abuse myself, I began to start having dreams about it, right? So I would have dreams that I was experiencing what they were experiencing because they had told me in such detail what had happened. I started being hyper vigilant in that I would be at the mall and I would say, oh, I think I see power and control dynamics in that relationship, right? So I'd start seeing domestic violence around the community. So mental health providers, and actually there's an interesting statistic in terms of compassion fatigue, that over 45% of psychologists tend to score in the burnout range. So mental health providers are actually one of the fields that are a bit more high risk for developing compassion fatigue. But we also, like I say, we have that component of vicarious trauma that medical providers absolutely may experience as well, but maybe not to the same degree that mental health providers, particularly people who are working with trauma victims on a regular basis, will have.
Interesting.
Yeah, which is also talked about in the free training. So if somebody wants more information, there's a little bit more there.
Cool. Well,
thank you for that question.
Yeah, great question for sure. Cool. Well, I guess if there aren't any other questions, that will about do it for tonight. So thanks again for joining. I definitely learned a lot, and
Thanks for having me.
I'm sure my audience did as well. So yeah, as with all my episodes of the show, Increase Your Impact, all episodes can be found on my website at kevinlangman.com/increaseyouриmpact, as well as on iTunes. If you search me up on iTunes, you can find it there too. So yes, thanks for joining me. And next week, I'll be back actually on Monday, April 4th, special time for my guest this week, who is Roger Rogelio. And we're going to be talking about fighting sports and how there might be some misconceptions around, violence and all that, and what kind of positive benefits participating in fighting sports can actually bring. So That's another subject that I don't know a lot about myself, but I'm looking forward to learning more, so it should be cool. So thanks again, Shar, for joining, and we will talk
Thanks
to you
for
again.
having me.
We'll talk to you again soon.